There's silence in the room, so I better start talking. Hi there, everyone. Thank you for taking the time out on this beautiful sunny Sunday to come out and see us all. This is Dr. Zaid Radanzi. He's from Canada, but he's also working in the United States doing this wonderful technology. So I'm going to explain a little bit about what we're going to do today and how the day is going to go. I'll tell you a little bit about my background. And we're also doing light therapy sessions as well. So this is a kind of a packed afternoon. We're going to cram a lot in a little bit of time. We're going to try to end up being done by 3 o'clock and having everybody's questions all answered. Over on this side of the room, we're going to do light therapy. This is the actual hyperbaric chamber that we've been using in the Syracuse area now for the last 4 months. It's portable. It fit in. Phil Alfieri is the technician with the hyperbaric chamber. It fit in his Toyota or his car, so it's quite convenient. So we blew it up today. No one's in there right now. You can look, but there's actually light therapy running inside the oxygen chamber, and this is something that Dr. Z actually thought of himself. And I'm going to explain a little bit about how I know Dr. Zaid and what I have experienced in my relationship with Dr. Zaid and the people he knows. So my name is Patty Sorreo, and I'm a nutritionist, and I live and work in Syracuse, New York, but I travel doing light therapy and nutrition in other parts of the country. And when I was doing the light therapy about 2 years ago, Dr. Zaid had come to Houston, Texas. I sponsored him to come there, and he worked with some of my clients and explained some of the programs that he was doing in Canada, and then he decided to move to the United States. When did you move, Dr. Zaid? About 1.5 years, 2 years ago? So he's also in Palm Springs, California. He works in Florida as well. He has a very successful clinic dealing with chronic patients. He's dealt with all kinds of issues, and including his own, and I'll let Dr. Zaid tell his story, but his own severe injury that he had about 1 year ago. And I'll just give you a little bit of the story of what happened with that. I heard Dr. Zaid was in an accident, and I'll let him tell you what it was. And I was shocked, and I heard how severe the accident was, and my heart was just shattered. I thought, oh no, this man is hurt, and he's so talented, and he's so wonderful, and he's such a good man. Oh, the world is, in my mind, going to stop. Well, that happened, and a week later, somebody got on the phone with me and said, oh, he's fine. He's doing what he does. He practices what he preaches, and he's back out working. And I thought, are you kidding me? So he'll tell you a little bit about that. But I just want to do some housekeeping for today. I'm going to wait till everybody kind of pours in, and we'll just talk about the housekeeping. So first of all, this is the emergency exit, so we can't block that. The bathrooms are in the back of the store. There's a juice bar that's really got incredible juices here. There's green juices and carrot juices that are really wonderful, and smoothies. So if you need a refreshment, they're right outside. You probably walk by them. There is a wonderful store here. They carry everything. They have everything from makeup and natural soap products to every kind of food you can imagine. This is the place to stop and shop in Syracuse, New York for health food. And Wendy Meyerson is the owner. She does a wonderful job. I appreciate her having us back here for the second time. We were here about 1 year ago doing the light therapy, and now we're bringing in the two therapies combined, which you'll see how powerful it is. And the other thing is, let me see if I got everything covered. Oh, tomorrow night we're going to be at the Maplewood Inn, and tomorrow during the day at 2 o'clock and 6:30. So there's flyers for that if you want to hand them out. Jetty is over here and Phil's over here. They're going to be doing the light therapy during the seminar. So the lights, what we do with the light therapy is they're 20-minute sessions. We have all the different parts and accessories here. Actually, we rent the light therapy devices, and we have this. I'm going to show everybody this now. This is a a foot pad. This is one of the parts of the light therapy, but we have back pads and eye masks and all kinds of things. So the light therapies are 20-minute sessions. We have 4 machines lined up at once, so you can anybody who signed a waiver can do a light therapy. The 2 things we ask that when you're all done is tell the person that you're working with what you want to deal with and put it on your waiver. Drink water before your session because you'll have a better session. And also, when you're done, we have a little paperwork we want everybody to fill out. So if you can all do that with us, that would be great. I was going to add, Phil is actually, did he leave the room? Guess he did. He's been working with the light therapy at Dr. Steve Wexler's office, who actually set up this seminar today. Dr. Steve Wexler is a chiropractor, but this is a portable unit. It can go wherever you are. Our goal is to educate people on the high technology, cutting edge therapies that are out there today, and you can see what we're doing inside our own homes and in separate offices. Many of the practitioners that are in this room, Tess Contos and Cruz Howe and Carolyn Cesari, use the light therapy, and they've been using it in their practices. So if you want light therapy treatments, there's some people that have them in their home use and they're growing business parts of it and getting their certification. We can hook you up and connect you with those people as well if you want, and we do sessions in the office in Liverpool too. The hyperbaric, you do need a doctor's prescription if you're going to do the hyperbaric and an exam, a quick exam to get approved. And Dr. Zaid can explain a little bit more about that. It's very basic, and it's not much, so Dr. Zaid can speak about that. So, Phil, I'm going to hand over the microphone with you to talk about your experience using the hyperbaric, and then we'll and maybe even a few of the light therapy people you've dealt with, and then we'll have Dr. Zaid come up. And if anybody has any questions, we'll try to hold them till the end just because we want it for time's sake, and then we'll do them all at the end. So, Z-A-Y-D. You know what? Let me read a little bit about Dr. Zaid. I'm sorry. I didn't give his full credentials, but he's got it going on. Oh, and I just dropped his bag. So, okay, so Dr. Zaid is a hands-on kind of guy. And from what I know and what I've seen, he cares about people. And he's been into holistic medicine for at least 17 years, maybe longer. Is that right, Zaid? 17 years? He's a licensed naturopathic physician with advanced training and certification in hyperbaric oxygen therapy, therapeutic and laser therapy, biooxidative medicine, and more. He holds a Bachelor of Science in Dietetics from University of British Columbia. With an in-depth understanding of profound effects of air, light, food, and water within the body, Zaid specializes in treatments of brain injury, stroke, neurological conditions, and has been instrumental in the growth of this field throughout the medical community. He took part in opening up the first hyperbaric oxygen clinic in Vancouver, BC, which is a really interesting story. But basically, Zaid has a clinic that's been open day and night for how many years? And except Christmas, it was closed Christmas Eve. How many years has it been open with it? How many? 17 years with the oxygen chamber running all those years. So he's probably worked with more people using the hyperbaric chambers than anybody, I'd say, at least in this country. So Phil is starting to work with people in Syracuse. Zaid trained him, and I'm going to have Phil share more information.
Hi, everybody. Thanks for coming. I've only worked on a few people, and I had the opportunity to work on myself, so I'll tell you that first. I went to Denver, and out in Denver, I ate a cherry, and I cracked 2 of my teeth. And I cracked the root. So the dentist out there said, there's no way to do a root canal. We need to take them out and do implants. So I called the doctor back here, and I called Patty, and I said, I've got a week and a half, I've got to stay here, what should I do? So I had my teeth bonded. I had the 4 teeth bonded together. I did antibiotics until I came back. The infection stayed the whole time. When I came back, I talked to Patty, Zaid, and a couple of other dentists, did supplements, got off the antibiotics, got on supplements, and did the hyperbaric chamber twice a day, every day. After 4 days, the infection was visibly gone, and after a week, you could touch my mouth here, and it didn't hurt at all. The complete infection was gone. My teeth got whiter, my gum got completely pink, and after about 2 weeks, I could chew on that side. I felt great. I saved those 2 teeth. So they were talking about pulling 2 teeth, doing a bone graft, and then doing 2 implants. So they're talking around $10,000. So in 2 weeks, using the hyperbaric chamber, a couple $100 worth of supplements, and the blue light and red light while I was in the chamber, I saved that much money, and I still have my own teeth. Before I went to Denver, I started working on a gentleman who's in his late 70s, and when I met him, he didn't remember my name for 2 weeks, never remembered seeing the chamber for 2 weeks. Every time he came in, Monday and Wednesday, Friday, I was introducing him to the chamber for the first time every time. Never saw me, didn't know where. When he walked in, if you walked him in the room and stopped and went off to talk, he would be like this for 10 minutes. Very catatonic, very connected to the world. So we got him in the chamber. After about 3 weeks, he started, hey, Phil, how you doing? I'm going to get in the chamber today, aren't I? I have to take my shoes off. Now it's been 33 treatments. He comes in. He's wearing his favorite hat. He's got his hair combed. He's got his shirt all nice. He talks. He connects with everybody. He makes jokes. And he is, I just met him. So I talked to the people that knew him, and they said he's what he was 5 years ago. And in 1 year, he went down real quick. So they said, he's joking. He's great. He's getting around. He's doing more physical activity. At the beginning, I had to literally pull him out of the chamber. Now he works his way up, grabs onto this, stands right up, and gets out. So in 10, 12 weeks, he's totally got his life back, totally changed. It's changed his mind, it's changed his physical appearance, and it's really changed his memory. So that was a really, he's got a few more treatments, and we expect a lot more out of him. Some of the people that I put in the chamber to try it, I put a chiropractor in here that most of you guys know, Steve. He had great results mentally. He felt great. He felt very calm. But the big thing was he had very low blood pressure compared to what he normally had. His blood pressure was normal after getting in it about 6 times. And when he did his bike rides, he usually had a spot where this bike ride, I'm going to have angina and I'm going to feel it. And he just breezed right through his rides, and everything was great. So he could really tell the difference. And another psychologist got in there, and he was in it for a few times, and he mentally had a great shift. So it's a great device, and like we say, there's 0 side effects, so it's a great piece of equipment, and I really like that I've still got my original teeth.
And the one thing I do want to stress is that Dr. Zaid actually combined a couple of therapies with the oxygen chamber. And the ones that we're using, you can actually use the light therapy inside the chamber, which is a very unique thing. So I call it the Z effect. That was something I coined. But he basically thought of the fact that let's try to get a chamber set up. So he actually works with the company directly and had this system designed particularly for the use of the lights inside of it. So without any more talk from myself, I'd like to introduce Dr. Zaid Ratansi. Oh, and just so everyone knows, poor Dr. Zaid, they left his suitcase in Charlotte, so if anybody has any donations you could give him, he'd appreciate it. You want it? I'm going to take it.
Hey guys, I'll tell you one thing, I am freezing. Like, I had no idea it was this cold. Like, isn't it summer? No, not yet, I don't know.
Not anymore.
Like,
not till May.
You guys are, and you guys will all be here in a couple months? Um, wasn't there a clip to that, or no? Just put it in my pocket. Can you guys hear me? Okay. Yes, it is really cold. But I just stepped off the plane, and they did. My luggage went the other way. So I'm only in town for a day and a half, 2 days. Okay. Oh, you found it. We found the clip. Okay. So she's offering me a jacket. I'll take you up on it in a little while. So I remember that phone call, Patty. Patty called me and she goes, Tate, I need your advice, Phil. I said, what happened to Phil? Well, his teeth, and he's got 1.5 weeks or whatever, So so we brainstormed on a protocol, and wow, I'm glad to see it worked. Excellent. Yeah, that wasn't long ago, was it? That was just yeah, that was pretty recent. Short-term memory. So, anyways, let me give you a little history about myself. This is a hyperbaric chamber that I started in Canada, about 17 years ago. And it's a multi-place chamber. It's a large, 10, 20 people can go in. So it's a lot bigger than this. So it allowed me to get a lot of patient access really quick, because being the first private multi-place chamber in Canada, I had a 9-month waiting list about 3 days after opening. So it was busy. And we were doing 60 treatments a day. So I got to see a lot of conditions. And most of the people that came to see me in the beginning were in wheelchairs, and caregivers bringing wheelchairs. They'd stay for a month. They'd fly in, stay at one of the hotels, and we'd just do a month of oxygen and in the chamber. And the results were quite profound. And how I got into the field of hyperbaric was I went to a medical conference, not knowing what I was going to do. I graduated, and what I learned was the hospital use of of a hyperbaric chamber for diabetic wounds and non-healing wounds, stasis ulcers, and I was like, wow, what? Burns, yeah. And I just looked at the before, after, the pictures. This is a medical presentation, and then the theology of it, and it's like, wow. And I remember the doctor presenting goes, well, it's going to speed up healing and increase, reduce infection, reduce swelling, create new blood vessels. And then I thought, I think that sounds good for everyone, isn't it? Regardless if they have a really bad, you're going to wait until there's a wound that's about to be amputated before you finally say, well, let's get the physiological benefits of extra oxygen, right? So that's what got me into there, and I immediately had a large patient load of brain injuries because it was very strongly supported in research, but not out as one of the approved conditions for neurological. So they had to find private centers, and that's how they found me. And so it got really, really busy, and it got busier because when you start something like that, you get a lot of media hype, and the media comes in, and so it goes onto the news, and now people are getting interested. Well, when you get results, it gets even better. And so the clinic was very result oriented. So we'd always newspapers and news would always be writing up a story about one of our patients. We didn't tell them to go to it just happened. So it was quite interesting how hyperbaric just really started, especially for me when I started. So I'm gonna start by talking about. We're gonna go right down to the basics here, because people say, "What is hyperbaric oxygen, and what are you doing? And why do I have to be in that submarine or whatever?" So You guys all know what the universe, or you might not know what the universe looks like, but that's what sort of. You got galaxies, solar systems in there. But you'll notice we are somewhere right there, where that's the sun, and then we have the Earth spinning around, so planets. And we're human beings on there. We have organs and like a brain. There's an organ. Brain has tissues, brain tissue, heart tissue, and every tissue has cells, brain cells. Every cell has an atom, has atoms. So ultimately, when you look at the hierarchy and who we are, is we're a collection of these atoms. And these atoms are positive energy right there, and then these electrons spinning around. Anyone see the electrons spinning on my hand? You went out last night, didn't you? She said, yeah? Yeah. That's a good question. Well, the neutrons and protons are right dead center. That's your central core of positive energy. So it has the neutrons is in there and the protons, and then the electrons, depending on the protons, would spin around from that. I've never calculated the speed. It moves too fast for me. Yeah. But anyways, if you ultimately look, energy, and if you can understand that, that means that every human being is just pure energy. We're energetic. We're energy at our base. And anyone go to Vegas and see all the lights and the energy there? Right? But we are mass consumers of this energy. And where does the energy come from? You might not be moving, you're sleeping, or you're not paying attention to me. And what happens is...
We got to get 1, 2, 3, 4 like this, whoever they are with the waiver. Yeah, so we're going to start over here. If you want to bring the waiver. Sorry, Dave.
Okay. I'll talk to you guys. Mass consumers. And that is the actual, and that's the whole reason why that happens. Do you guys all get that? Okay. Let's move on. So where do we get energy from? Who's eating? What type of food? Naturally local grown food. Okay. So we all agree you need food for energy? Everyone agrees? Yeah. Okay. I'll do a test with you. Okay. Okay. When was the last time you ate? Okay. How many moments ago? 5 minutes. Okay. And how much energy do you feel like you have? Fair amount, good amount. Okay. Okay. So you haven't eaten for 5 minutes, and you had a fair amount of energy. Okay. Now, don't breathe for 5 minutes, and tell me how much energy you have. She's not going to do it. And if you do it, don't blame. Okay. Okay. Let's understand this concept. This is actually a really important concept. Is energy, and it's energy transfer. And what you're doing is you're breathing oxygen. And all oxygen is doing is it's transferring the energy of food into usable energy for your body. That's it. That's one of the primary roles of oxygen. Primary. And like I said, do that test and you'll understand how much energy you have. That's why. All this energy, you said food. Yes, absolutely. These electrons are spinning around. And this is a cell. You have 100 trillion cells all demanding energy. 100 trillion cells all demanding energy. Every cell needs to just stay alive, forget function, repair, regeneration. So where does that energy come from? It's right here. It's the mitochondria. This little molecule is where the conversion happens of food to cellular energy. It's called ATP. Who's heard of ATP? Wow. Okay. So, ATP, food has abundance of energy. We all have a lot of food just sitting in energy, but we can't use it unless we have oxygen that goes into this little molecule, and then it converts the energy into this ATP. Now, this is the currency that your body uses for electrons, for everything. That's your currency. What's the currency here? The dollar. So, now, if you're in Syracuse, right? And you have, let's say, Japanese yen. Would that work? Like going, go to the till and see if you could buy a soup and a chili, and they won't take it. But what they'll do is they'll say, go to the bank and convert it to my currency. And so you have food, you have carbohydrates, proteins, you have all these different currencies, but it means nothing to the body unless there's that conversion. So think of the mitochondria. This is the organelle. It's called a mitochondria. Think of that as the bank, or bank machines. And every cell has a whole bunch of these banks, and that's where conversion happens. Is that simple? Now you can go back to school and actually pass that chemistry. But that's basically it. Not basically, but that's what's going on into your body. So I call it money. I call this ATP money. Now, how many people out here like money? You like money. You won't put up your hand. She put up her hand. You like money. Of course you put up your hand. So everyone likes money. Wait. Who doesn't like money? Yeah. So, you think about it. If I were to give you more money, each person, would you be okay with that? Would you say no? You would spend it? Would you spend it? Yeah. What would you spend it on? Okay. Right. Forget the essentials. Forget my house, my leaky roof, and what if I give you an unlimited supply of money? Okay. And take a look at the body's currency of energy is ATP. So, and it spends on function, repair, and regeneration. That's what your if you cut yourself, what happens? It bleeds, it gets inflamed, and it heals. Your body has an innate ability to heal. The more energy it has, the better it heals, the quicker it heals. We know this. The body knows. Every cell, you think a brain cell is different than a skin, heart, brain? It's all ultimately the same thing. They have the same DNA, just different location, different function. So a skin can heal, but the brain can't. Not sure about that. So you take a look, but this is a determining factor is the energy levels. It's called ATP, and the more ATP your body has, the happier your body is. Okay, function, repair, and regeneration. Now, who likes being on a budget? Nobody. Yeah, you do. You like being? Do you like being? Do you like being? So this is Syracuse. Okay. 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 So you've accepted the budget. Yeah. Okay. Good. Good. So okay. Now, what if? Okay. So what if you had your nice budget and you have a family of 4, let's say. 4, 3, 4.
I don't know. I have a family of 1 child, honestly.
Okay.
That's all the budget I can afford.
Well, let's say you had 4 people that you had to, and you made all the money for all 4. So you spent money on clothes, of course, essentials, and then what else do you have to? Food, education. So those are essentials. Okay. Well, what are some luxury things? Okay. This is good. So, all of a sudden you lose your job. Okay, what are you going to cut out? Okay. So you have no job for let's say 6 months, and you're expecting to work in 6 months. So you do a little budget, right? You would have to. Okay. You didn't get that job in 6 months. You still have no work. It's now a year without any income. What? All right. They give you welfare. Welfare. Hard life. Okay. Now it's 2 years. That's okay? Okay. Now you have a house, and you're trying to decide. Well, the roof has a little leak, but it would cost a lot of money to fix the roof, to replace the roof. But you could patch it because you still think you're going to get money. Okay, so you do a little patch. Okay, now it's 5 years. Okay. I'm bringing a point that the body is it's like Syracuse. It's very good on a budget. That's good. That's fine. The body will it will rationalize. Like there comes a point where energy is at a, what would you say? Not a surplus, but what's the opposite of surplus? A deficit. There you go. And eventually, that's where it gets to. So when you're talking about 100 trillion cells, and we're getting less and less energy. Now, do you know why you're getting less energy? You're wrong. I heard, because everyone says oxygen. There's pollution, right? That's right. Pollution and all this stuff, and less oxygen, and this is an oxygen talk, so it has to be oxygen. It's actually, when we breathe, there's plenty of oxygen. Air has 21% oxygen, Hey, you can breathe out the oxygen you're not even using. You give CPR to someone. It's because you're not, you don't even in air, 21%. And if I took your pulse oximetry, you know what? I think I might have one. If I took a measurement of someone's oxygen levels, you want to try? It will probably say 97 to 99%. Let's take a look. Let's see. Did you sign a consent? It's not me. What does it say? 98. Yes. Yes. Not at all. Not even close. That's why when you're breathing out, it's oxygen you can't, and you're probably breathing about 16%. So, you know. It's coming up in 3 slides, I think. But it always changes. I never know what I'm going to talk. Okay, so what's happening is the oxygen that gets from the air into your blood. It's when the red blood cells, when the blood goes through the lungs, it's like a magnet, and oxygen just goes to the red blood cells, and you're 98% full. You just don't need any more, so you breathe it out. We can't get any more in. So then, why are people getting in the tissue levels low oxygen? Yes. Okay, yeah, okay. So a major injury or whatever, yeah. Hey, there's an earthquake. My house got damaged. I need a lot of money to fix it. There's an organ damage. Okay. Well, we'll talk about alkalinity. Anyone else have a guess? Huh? Activity? Absorption? Mitochondria? Come on, guys. Okay, what's the answer back there? Patty? What's the answer? If anyone knows Patty, she never listens to me to begin with, so why would she pay attention? I'm going to give you guys the answer. The answer is your blood vessels, cardiovascular disease. The number one killer for North Americans is a heart attack or a stroke. What is that? It's blood vessel damage. It starts at 5 years of age. We get fatty streaks in arteries. It's just arteries that have plaque in them, and the blood vessels get narrowed. And it's a thing that happens in all of us. But as age, it just gets more narrowed. You know, I used to do cadaver dissection and cutting up, and I remember these arteries, and they'd be crunchy and calcified, and the professor would be like, "Oh, that's normal." I was like, "That's normal?" And they're all crunchy and all calcified. The holes are so small. So what? Yes. Right. For cardiovascular disease, I'd say normal and common. But for diagnosed, if you were medically diagnosed, you know what? The first sign or symptom is a heart attack. You know, that's a tough one. But when we look at age demographics, about by the time 80s hit around, I think it's about 90-something%. You know, it's a process that happens. But don't think it's an all or nothing. Like at 50, it's a complete blockage, and it's called a stroke or a heart attack. But at 50, it might not be complete. It might be, what I call it is 5 lanes going to 2 lanes. You know? And what happens when you guys have rush hour traffic here? No? Okay. Okay. Um, um, I was on the plane today with this morning with the Syracuse. Um, uh, they're really tall. They must have been basketball or volleyball, but they were tall. Anyways, I just thought I'd let you guys know. It was some team, yeah. Must have been. I don't know. Whatever. But traffic. So the way I look at it, when the baby is born, the heart pumps and it's a 5-lane highway to the brain. Everyone's happy. What does blood carry? Oxygen, because red blood cells. As time goes, now gradually, it's okay. You know, let's say the brain gets 1,000 of these ATP or oxygen molecules, and all of a sudden, now at 20, it might be 4 lanes, and now it only has 800 in an area, and it says, well, 200 here, 200. You know, it just slowly, gets less oxygen, and that has less energy to the tissue. Well, by the time I went to a retirement elderly home, no one's moving. You know, I went. They were like 80, 90, and still young when you think about it on the DNA part of it. But they're like sitting there, like there's no energy. Like 1 lane to the brain. Hearing, vision, everything, because there's so little blood flow when you look at it that way, that you only have this much energy. I'm not going to go and buy a boat. Are you? No, I'm going to. Yeah, I'm going to. Yeah, I'm going to. Just to make sure I have some food. You're going to just sort of go to your bare essentials, but then eventually, oh man, that patch-up job didn't work that well on that roof. And the roof, so it's energy. Your body is energetic dependent. Yes. Six slides away. You want to try 9? Try your luck. Did you see my presentation before? Okay. Hyperbaric oxygen. I'm gonna explain something that I've been involved in for a long time that I think can be very beneficial to all of us, particularly those who have a condition that may benefit with the application of hyperbaric. So here is the lungs. Do you know the lungs is composed of all these little grape-like sacs called alveoli? You've heard of that? You have? Yeah. How many are in your lungs? How many millions? 500 million. At least you got that. And all that's happening is oxygen, just like a magnet, gets onto these red blood cells, and you're full, right? 98%. That means you have. Well, let's take a look at this slide. This is your blood flow. When we take blood right here, right? We say cold blood, and we spin it. If we spin it, we get liquid called plasma, and we get these red blood cells. Does that make sense? And in these red blood cells is where all the oxygen is. 97% or 98%. But this is an example of a red blood cell. And each red blood cell has a hemoglobin on it. Have you heard of hemoglobin? Okay. Hemoglobin carries 4 sites of oxygen. So that's the magnet. Boom. And on this red blood cell, how many hemoglobins are on there? How many hemoglobins on one red blood cell? Just one of these little suckers on that big? How many? 37 is absolutely wrong. Roughly 250 million. That means red. Yes. Yeah. No. She got that wrong. Correct. You tell me. No, it's simple mathematics. 250 million times 4. That's a billion. So, up to a billion little tiny... Look at the periodic table and you see oxygen molecules very, very tiny and very small. She's got 980 million on that one, on the red blood cell. That's pretty impressive, eh? Yeah. But can you see how important this little oxygen molecule is? That is... I'm trying to give you the importance of it. Do you know for the amount of oxygen that you consume in a day, it's equivalent... Okay, remember how small this is? To 6 pounds. Imagine gaining 6 pounds, but you don't, because that is gone. That's how much oxygen you're using. What? Are we done? I just started. Okay, so okay, we're going to talk about $1 billion, up to a billion oxygen molecules. Remember that word ATP? I met a really smart guy a couple of days ago, and he said, he asked me, he said, well, how many ATP does your body use? How much of this money does your body use in a day? Take a guess. Whoa. Yeah, exactly. And you have a billion on each one. So the amount of energy you consume in ATP is equivalent to your body weight in one day. Correct. But that's how much the body needs in daily energy. Your body needs. That's how. You're getting an idea of how, and here we are in medicine trying to, fix and do this. Well, the body has this ability to do it. Just give it some funding, right? Okay. Oh. Now, this is an important part. What's the point of, how do you get more oxygen into your body? Give me some smart, who's going to help me on this one? Deep breathing, okay. Okay. Okay, you'll be breathing harder, but then your body will be using all that, so you'll be still at a deficit. So, okay, carry on. Anyone? Huh? Okay, yeah, that's a good one. Get more red blood cells. Yeah, do an infusion. You can do that. So, you guys are missing the blue elephant. Those. Yeah. No exercise. If you do altitude, if you go up because of the for blood flow, but that's the tissue. So it depends on what your primary goal is. A lot of people would say, "Oh, just drink oxygen, right? Oxygenated water." No. Yeah. Well, remember, it's your lungs where you get your oxygen. If you put something in your stomach, there's no gas transport that happens there. So You don't drink it. You don't eat it. You don't bathe in it. Anyone who tells you, oh yeah, you could be surrounded by it, say, okay, do that. Don't breathe for 5 minutes and see how well the oxygen absorption happens. They won't do it. You guys won't do it. But so what's happening is calling number 7. Yes. Yeah. Excellent.
So what is it about high altitude? I know the oxygen is thinner, but I don't really know what that means.
Okay, so that's what's happening is your body goes under stress and now has to compensate by creating more red blood cells to get more oxygen. Now that brings up my point, the next point, which is probably the most important understanding. In even I've got to explain this to doctors to get them to understand how hyperbaric oxygen therapy works. Okay, so if the other example people often give is just put a mask on and breathe 100% oxygen, right? But remember, your red blood cells are already full. Now, when you breathe, remember I said red blood cells have all the oxygen here? There's a very tiny amount that in this plasma, very tiny, in all of us. But here's what happens. When you go down in pressure, the greater the pressure, the more oxygen dissolves in this liquid. It's super saturating. That's all you're doing when you go in a hyperbaric chamber is you're increasing, if your oxygen levels are here, you're increasing it to here or there. You're increasing your oxygen, but in a different body, in a different compartment, in plasma. Now, I'm going to tell you one of the biggest studies that came out in hyperbaric oxygen in 1960, and this is a study that they took these pigs. Okay, they took these pigs and took all the red blood cells out, so they had no red blood cells, and they infused them with saline, just water, saline, in a hyperbaric chamber. And guess what happened? The pigs were fine. There was no brain damage, nothing, until they cut them up, and but had to be dissected. But this is the important part of hyperbarics. This is the fundamental part, is because the title was called Life Without Blood. And what they said is this delivery system of a hyperbaric chamber just in the plasma was enough to give life. Well, there's something even more important. And that's the reason why one of the hospital treatments is still right now in hospital is severe blood loss anemia. If you're anemia and you're going to die, they put you in a hyperbaric chamber, or carbon monoxide poisoning. Those are hospital reasons because of this delivery. That's why. That's why the hospitals have it for that treatment. But take a look at that liquid. What is most of your body? Liquid. 91% of this plasma is water. And when you get oxygen, these little tiny oxygen in there, it's different than, think of how big that boat is to have 1 billion of these little oxygen molecules. And in a hyperbaric chamber, you put the oxygen in the liquid. Forget the red blood cell. And the power of that is now the oxygen is carried wherever there's liquid. Okay? The importance of that is cerebrospinal fluid, the fluid that bathes the brain and the spinal cord. There's a transfer, interstitial fluids where there's swelling. You've heard of inflammation. Inflammation, you can't get blood in there. Then it's this chronic process. In a hyperbaric chamber, the oxygen is in the liquid, is in the plasma. And that's how it gets, yes? It's coming. Patience is a virtue. It is Sunday. You want me to give you a little sermon? Patience. Everyone. No. Okay. Well, I've got to answer her question on this side. Okay. There you go. Now, these are 13 hospital conditions you can go into hyperbaric chamber. Non-healing wounds, wounds that are about to be amputated, like we said, burns, decompression sickness, flesh-eating disease, bone infections, osteomyelitis. These are pretty serious conditions. And just go and get more oxygen. And we're trying to think, oh, it's a drug. It's actually your body. We focus on non-healing wounds because, just what does that mean? Not just skin, like your whole body, liver, brain, So what do? This is an example of a non-healing wound. And what you see is red blood cells that all of a sudden have a roadblock, right? And this would be from, let's say, an injury. This is a model of a wound, so we'll say this one is an injury. So you'll have just a little bit of trickling of red blood cells. But this tissue is all fine. You see those O, that's an O molecule. So oxygen perfuses there. This tissue is fine. But past this injured state, all this tissue starts degenerating. Okay? Now, in a hyperbaric chamber, oxygen goes, all these O2 molecules goes in the liquid. There's tons of liquid, way past inflammatory, And now the free oxygen go back and start this repair and regeneration of tissue. That's one of the big effects of hyperbaric, of extra oxygen, is think of three things: function, repair, regeneration. Oh man, these are dead tissue, or let's regenerate, let's repair. But now there's so much energy that that they start creating these little tips, new blood vessels. It's called collateral blood flow circulation. So now, eventually, this little roadblock, the red blood cells will start taking these and now oxygenating this tissue. It's a natural process, and that's where we're getting to your answer. Correct. And that's a slide that you're okay. Plasma is not a molecule. Plasma does. No, but plasma carries hormones, and plasma is liquid.
Yeah, I understand.
Okay.
It has a molecule that makes up a bunch of molecules.
Yes. Okay. So.
What size of that is compared to?
There. Sorry. It's plasma is it's the liquid part, so it's got just proteins and enzymes and hormones.
Water is a liquid.
Yes.
And it's H2O.
Yes.
Do you know the size of that?
Yeah.
There's no, you can't, I mean, that's not a reasonable question.
I guess I don't know then. Yeah, I wouldn't.
But it's really a lot smaller, obviously, but I didn't know if maybe there was a size.
No, oxygen is smaller. Oxygen.
Yeah, no, I'm talking about the size of the, I mean, plasma's getting through where hemoglobin can't.
Think of it like a river, okay? Like you have a river, and you have a big boat called a red blood cell, and the boat, and then you have little cars and people or people, and you throw the people overboard, and now you have the little person relative to the side that you have a little person, in going downstream in the water, and the little person is the oxygen molecule that in the river is like the plasma. And the river could be composed of some have dirty river water, some have clean river water, and some, so. No. Yeah. Correct. Yeah. Whoa. Hey, whoa. Billion. Fail.
I got the concept. I'm looking at the flow. I'm just looking.
Okay.
I forget I even asked it.
No, I got it. Never be sorry.
So it's like a billion to one, the difference between a red blood cell and a oxygen or a hydrogen.
And the reason why I brought it up is you think you got two little islands, whatever, and you think a boat can't get through there. Oh, but take a little rowboat and you can go down, or it's and that's why these oxygen molecules just get so wherever there's liquid coming from there. So it's not only when you go to the hyperbaric chamber you get more oxygen, it's where you get the oxygen, and I call that the hyperbaric effect, because there's a big difference on how when you're in a hyperbaric chamber, anti-inflammatory genes turn up, down-regulates pro-inflammatory, and your body starts healing, and it's just oxygen. This is an example of a standard wound that we see. It's not lunchtime yet. Oh, it is. On the West Coast. Still 11. So this is a diabetic wound that normally we see before they're going to amputate. This is after 3 weeks being in the chamber, and this is after 6 weeks. About 90 minutes. 990. Yeah. That was a little bit. Yeah. And what it does is speed up healing, reduce swelling, blood vessels. Exactly what I told you that, now what about the brain? The brain takes up 25% of your oxygen. So obviously, the brain would be a good one to add this hyperbaric effect. So, you know what? All organ systems we've seen have benefited from a course of hyperbarics. What is a typical delivery system? So you asked the question. It normally is 60 to 90 minutes, once or twice a day, 5 days a week for 4 to 8 weeks. That's a standard prescription. That's a standard dosage of just like a course of antibiotics. But that is what's been shown for many of these patients coming in with. I don't normally recommend that. If someone has a home chamber, yeah, you can do it whenever you want, But I don't answer personal questions, but I will. Yes. Yeah. Here's the thing. This is about. You know what? The goal is we can't go back in time. Oh man, I wish I didn't eat at McDonald's and do all that and have that, and we got cardiovascular disease, we got environmental chemicals and toxicity, and what we're doing is trying to help rebuild your cardiovascular system, tissue and all that, and now have the opportunity of healthy living. Like, look at this. This is one of the nicest health food stores I've seen, but eat clean, and use a good example. I give diabetics, and we'll talk about diabetes, because people say, okay, I'm not diabetic anymore, but for the amount of years that they were diabetic, what happens is the blood sugars spill into the blood vessels and cause blood vessel disease, and that's really what diabetes is. I make fun of people in front. Okay.
I can take it.
Like a lot. Yeah. Correct. But it goes down below sea level. But it doesn't physically move. I had this one patient from Alberta, and he was about 80 something, and then I could tell he was a little worried, and then he goes in. This is the big one. And then just before he goes, okay, I just have to ask, if there's an emergency, is there a ladder I can get back up on? Oh, yeah, hang on. 2 questions. What's your... Yes, we'll talk about all that. Excellent. Good question. Yes, and we're going to talk about that at the same time as that. That's one. Tissue regeneration. That's the end of the lecture. And that keeps everyone to the end. Because that's what I do. And I think it's a very good, cost-effective way to be healthy. Okay, so these are studies. Don't worry, I can give you a whole bunch of... I have a website, and I do research and stuff. Okay, these are current applications of hyperbaric oxygen by the International Hyperbaric Association. Cancer, sports, diabetes, inflammation, neurological, anti-aging. Don't do anti-aging. Just healthy aging. You know, it's... Yes. Huh? You see, we're going to go through each one. Yeah, so now I'm doing cancer. Okay, everyone can read this? So, you guys can't read that? Okay, can you read this one instead? It's the same as this, but it's just bigger. Okay. So, when I first started, I never treated any cancer patients with hyperbaric because we didn't know about safety. You can't do anything unless it's safe. And why? You should know. You're sitting in the front. Why would I have been concerned? Why would I have been concerned? Wrong. Huh? Correct. Wrong. I'm being angiogenesis, correct. Because we know that it helps heal by creating new blood vessels and angiogenesis. Well, what if it helped the cancer with angiogenesis? Because that's a big thing on how cancer grows. So I didn't want to take a chance. There wasn't enough research, and nope. But patients would come to me and say, "Cancer hates oxygen. I want to go in." "Ma'am, sorry, I can't let you." "Who are you to tell?" Oh, they would yell at me, and they'd say, "I'm getting into the chamber." So it was a difficult one, especially having the only chamber in Canada or private multiplace for that. So then, you know what happened? There was so much research that came out to look at safety, and the safety actually demonstrated quite well. But while the safety studies were going on, they showed some cancers actually had a reduction in tumor volume. And then it got really exciting. So then I started saying, okay, but I always did it with the cancer treatment, some IV therapy or whatever. And then we looked, and have you heard of chemotherapy? Have you heard of chemoresistance? Radio resistance? It really pisses off the oncologists because they're like, "Oh, he's resistant to my chemo." My chemo is the cancer is resistant. I'm an oncologist. I'm giving the right dose. Body's resistant. It's got resistance. Well, you know what was found with this whole resistance? A lot of it had to do with tumor hypoxia, low oxygen in the tumor. And when the tumor was low oxygen, the radiation, how it works is it splices oxygen. That's how it kills. These are all radiation and chemo are oxidative. So it helped. It helped with me when I had oncologists on board because it was shown quite clearly that hyperbaric oxygen helped in something called chemo and radiosensitivity. It made chemo more sensitive and radiation more sensitive, and so now oncologists were happy, right? So it could very well be used within a program. But how does your body kill cancer? Anyone? Your immune system, white blood cells, it needs oxygen. It takes oxygen and makes oxyradicals, bleach, peroxide, and that's what it injects in. That's as simple as it's oxygen dependent. How your body kills bacteria and all that, apoptosis, phagocytosis, that is oxygen dependent. So not just does oxygen flood your body, give you energy, give you money, it has also a benefit for your white blood cells. Big time. Okay. Sports. Do you know there's over 400 NFL football players that have this chamber in their homes?
How many?
400. I've gone to a few of their houses to do a little training on them just for fun, but it's and there's a reason why. And the football players, I didn't realize how bad. And they'll go in it. There's one smaller than that they take. It's a travel size, and they take it. So these there's a smaller, like, home portable type model, and they use it after the games, not before. After. Not on these. It was a medical. Yeah. So I use both. I've had now plenty of patients that were chemically sensitive, because I deal with the chemical sensitivity patients, and there's in the the actual manufacturing will off gas before they even ship it out. So it's about a 2-week delay in their chamber. But I've never had a problem with that. And but if they do have a problem, then there's no one's forced to do anything. But I haven't seen a reaction.
I noticed when I burned it, about a week, and this particular one has an oxygen mask, like he was breathing in the oxygen from the tube and the mask, so you don't know if you're right. And in terms of anxiety, because I'm talking, I'm every time for information, I'm talking to like, I have ear problems and blind, and all of them, like after, it's just like still experimented, and we figured out how to work with me, because I was like, I couldn't get in there for 1 second. But now I can do an hour.
But it's
So when I get treatment,
this is common. Almost every people say, "How am I going to get?" You know what? It's just, Well, you can put you can put 2 people in here, and You know what? One time it was weird. I put 2 in there and 3 came out. I didn't understand that. You like that one? Who wants to be the guinea pig? You two want to?
Are they sitting in chairs? Are they lying down?
Yeah, we have chairs, we have beds, we have benches, and they're all different sizes and forms. It does the same thing. But what it does with tissue injury and healing is a more tighter tensile collagen repair, so quicker, better repair, so really good for sports. Diabetes, I think every diabetic should be in get 40 hours just to repair. What's the biggest risk factor for diabetes? What's the biggest risk factor for diabetes? Yeah, amputation? Wrong. Blindness, wrong. Yeah. Huh? Kidney, wrong. Heart disease, right. She got it. Cardiovascular. You automatically, look at the Framingham study, you automatically, what? Of course there's a lot. But the primary one, it's the spilling in the blood vessels. Whether the blood vessel disease is to the nerves, neuropathy, eyes, retinopathy, it's your cardiovascular system. Of course, yeah. One. Right now, a big drug that we take is NSAIDs, anti-inflammatory drugs. Hyperbaric oxygen is very, very strong. Written up in the Journal of Pain for inflammatory-related pain syndromes, and especially when you combine it with light therapy. So that's diabetes. Also helps with glycemic control and fasting blood sugars. Inflammation. And inflammation is becoming a major cause of the heart disease, because that's where it's inflammation in the arteries that then the cholesterol and all that. You know, it's not everyone's blaming the cholesterol, but that's the thing that comes after. You know, so you got to look at the inflammation, and so Alzheimer's, cancers, diabetes, heart disease, you're going to the core by working on inflammation. Look at the colon cancer and all these cancers. All inflammatory based. Inflammation. Like, why wouldn't you want to reduce your inflammation? You know? Okay. Neurology. When you get extra oxygen, it gets into the plasma and then into the cerebrospinal fluid, and your brain gets oxygen. Your brain starts repairing. Probably the biggest things I've seen is for neurodevelopment conditions, kids with autism, cerebral palsy, fetal alcohol syndrome, Down syndrome. Then we go into strokes, head injuries, concussions, and then older individual with Parkinson's, Alzheimer's, Huntington's. We've done a lot of multiple sclerosis. Yeah, the glutathione and the hyperbaric combo is what I've always used, but they both independently have some benefits. Combined, I think they have better. But same, just energy, repair. Strokes. Someone was asking me a stroke. A stroke, you have a damage to an area, and there's a penumbra, there's idling neurons, there's recoverable tissue. And when you go into hyperbaric chamber, you get into that recoverable tissue. And you might not get the dead or infarcted tissue, but you'll get the recoverable tissue. One of the nice things about hyperbaric is long-term use promotes the mobilization of stem cells and new cells and what we call neurogenesis, new brain cells. And then the neurogenesis, it helps mobilize stem cells and increase your neurological stem cells. It's called neurogenesis, new brain cells. How many people want new brain cells? Oh, boy. You know how much research has been poured in on preconditioning? And what they've taken is they started with rats, and they preconditioned the rats. They threw these rats into a hyperbaric chamber, and then they gave them a stroke. And the rats that went into the chamber did way better. And so it's called preconditioning. Is now they're looking at heart for heart attacks and saying, hey, if we're going to have one, go into the chamber first. You know, like I'm looking. I'm like, right. You know, you if you're at that risk, you might want to carry on the hyperbaric program and not get the stroke or heart attack. But yeah, so that's for that. Aging, just extra energy, brain, heart, liver, joints, you know, all the thing. Light therapy is what you guys are having here, and who's had light therapy? Okay, who likes to have light therapy? Why do you like it? In what? Where do you put it? Where? Where do you put the light? You do your brain? Yeah. The only side effect is you could get lightheaded. That's really bad. Okay, I won't. Yikes. It's a tough crowd in Syracuse. I did overhear someone going in, and they're shopping, and one of the people helping was like, "What would you like?" Well, I need is vitamin D dangerous or whatever if I take and the person, the clerk here said, "Not in this area."
No danger here.
Oh, this is recorded. Okay, sorry. She didn't say that. Some other person said it. Really? My hands are still closed. Okay, guess what this is? What is that? That is ATP. But what's this? This is this. Okay, you've heard of the saying, "Energy can't be created or destroyed," right? Just transferred. So energy in light comes in, it doesn't leave your body, and it changes the cellular energy. How does that happen? It happens here. This is the mitochondria. Remember, this is the bank. This is where money is made, right? This ATP molecule right there. And food is converted to this, but oxygen is right here. That's where they combine. That's a combustion. And when these two meet, hydrogen ions pump out. Those H pluses, they just pump out a whole bunch of them, and then they want to come back in. But the energy of them coming back in twists this molecule about half a turn to put two of these together to make this ATP. So basically, every time oxygen is there, hydrogen comes out, comes back in, money is made. Come out. So it's this constant cycle, and then the body spends it straight away, and then all of a sudden it needs more. So it's a consumable. You're just always spending. Just like you shop, always spending. Always.
No, I'm thinking about
Oh wow. Oh. Okay.
and I was thinking about the fact that she is down there, which is definitely the right blood cells. And they thought that they were losing her because they're increasing her back. No, because she was so well trained.
Yeah.
Turned that in. Yeah. So I used blood therapy on her when I see her, which is not very often.
Yeah.
With Portland. But the point is, she doesn't have sensation in her left arm.
Yes, and we find that a lot. And yeah, and it's all about once you get feeling, then you move it. You've got to combine intensive physical therapy with oxygen or light. That is like someone will say, okay, is a car going to move anywhere if it doesn't have any gas? No, probably not, right? Unless you push it, yeah. But no, it's not going to. But generally, it's not going to move, right? So if you fill it up with the gas, that's good. Exactly. You still have to turn it on, and that's the point. This is going to be useless when you're doing a rehabilitation like that. You combine that with exercise. Whatever this is just pure energy. So then you say, I want brain energy. So you do brain exercises, memory exercise, whatever it is that you want function. Is you work with that on that, and that's yeah. Yes. Excellent. 3 slides. That's good. You want to sit up here too? She's going to want to go back. Oh, yeah. Yeah, good. Okay. You're going to like this one too. I feel like telling it to you right now, but so am I. Okay, so this is the mitochondria. Okay? This is like how oxygen works. So where does light come in? the same molecule. It's called cytochrome C oxidase, and when light goes in the body, it excites this and throws hydrogen up, and now the hydrogen comes back and you make money. That's how the Krebs cycle works, yes. Okay? So, what's the other name for Krebs? Citric acid? Okay. So, now, that is, so you take light and you just put it over an area, and all that photonic energy starts generating ATP. And then what do? Let the body do it. Let the body fix itself and rest. And that's why light therapy and hyperbaric therapy work so well. They're different, but they're so similar. They're similar because that exact process right there. They're different because I don't have to be smart. I just throw them in there and let the body, well, with light I got to point to, but a lot of times patients say, ow, it hurts there. Well, then that's easy, So light is directionally targeted. It's localized. Hyperbaric is general. We got to hurry.
And light also stimulates the production and reconstruction of mitochondria. Mitochondria has DNA in it. You can have 2 mitochondria in a cell. You can have 2,500 mitochondria in a cell. The light stimulates that mitochondria to go through cellular replication, create more power plants in that cell, so that you have an abundance of power plants in that area making energy for that cell.
Hey.
Part of mitochondria.
So does oxygen.
Yeah, oxygen does too.
Thank you. Don't put oxygen in the dark because of the light. You got it? Okay. Light transfers all its energy deep into the tissue. There's different wavelengths. Blue does superficial, red goes deeper and does nice muscles and whatever, and infrared goes really deep and does about. So you could do the whole body with a full light system, which is what is most light devices have. Yes. Third last slide. I'm going to tell you where it is, but it's about the third or so. Yeah. Energy. Okay. So. Okay, we're on your slide. Okay. When light carries energy, 3 things happen primarily. A whole bunch of ATP in that area, and then a whole bunch of nitric oxide and reactive oxygen species. Okay? So, let's talk about each one. What does ATP do? Make money, or it is money? It's the money. Does the body want more of that? Absolutely. And is the body going to spend it? Straight away. It spends it. Right? So this is money being spent. So light will. Now the second is what you were talking about, nitric oxide. Now, nitric oxide is a very short-term gas. And when light is going down into the tissue, it hits red blood cells. It knocks off a molecule called, in myoglobin, whatever, nitric oxide. Nitric oxide then, very short term, sends a signal, I think it's cyclic AMP or GMP, going to smooth muscle, and the smooth muscle, the arteries, relax. And what that does is opens. In other words, what you're doing is you're vasodilating. You're opening up the blood vessels. Now, my analogy for that is, now, you guys have been in rush hour traffic? Yeah? When it's rush hour traffic, would it be nice if you had 2 more lanes open? Just very temporarily for that 2 hours. Okay. What nitric oxide does is very short term, adds extra lanes, short term, but into the congested areas. It's called the microcirculation, the small blood vessels. Okay? Is that good? Yes?
So the plasma is distributed, the red blood cells in plasma are all distributed through the movement. So the light therapy is causing 5 lanes to open here, or should be 3 or 2 or whatever. And that's allowing this area, the chamber to force the oxygen.
We're not talking about chamber. They're independent right now.
Okay, but I'm not fast forwarding that while you're in there with the light therapy.
I haven't talked about that. What's the independence? Independence is light therapy over affected tissue can increase blood flow by opening up and causing more fluid, plasma and red blood cells to get in, and that's how. Now that's going to give you 4 secondary effects of light therapy, and some people say the 4th one is the main one. Some light therapists actually believe that Dr. Burke, increased circulation is the number 1 reason. Once you increase that, then you increase ATP. But there's enough research showing that the cytochrome C oxidase is a photoreceptor and independently can increase ATP. So it's an ongoing debate between light people. Yeah.
Light gets red blood cells, and what's the connection with the nitric oxide? And how does it affect? How does the light affect the
It's an energetic. We don't know, but it's an energetic release. So what we know is when light therapy is directed over area, there's all of a sudden a vast release of nitric oxide, measurable nitric oxide, and there's a huge increase in blood flow, circulation from that secondarily. So, energy can't be created or destroyed, so it's transferred. It's transferred, and then that's then transferred. So those are your 4 secondary effects: reduced inflammation, reduced pain, increased tissue regeneration, and increased circulation. Very similar to hyperbaric. Very good. Anti-inflammatory, it leads to final repair, different from NSAIDs. But tendinitis, these are all studies. I'll wing through these, but just to show how well light therapy works for tendinitis. The lungs, bronchitis, chronic obstructive bronchitis. They just put the light 20 minutes over the lungs, and reduction of elimination of clinical symptoms and promoted drainage. You got autoimmune thyroiditis, inflammation of the thyroid. They put light therapy for 10 days, 5 days a week for 2 weeks, and 30 days later, all patients reduced thyroid medications, levothyroxine, and 7 didn't even require any after 9-month follow-up. So it's very well known for its anti-inflammatory effects, and then wound healing, gums, bleeding of the gums, just like what you heard earlier, the teeth, and it really has a lot of dentists use them. Acute and chronic neck pain. Studies have shown both acute pain and neck pain. Pain is a big one, and especially inflammatory related pain. This was osteoarthritis, neck pain. This was published in the Lancet Journal 2009, and they took pain patients, acute neck pain, light therapy worked immediately after, but then they took chronic neck pain, and it reduced pain up to 22 weeks after completion. Can you imagine 22 weeks, 5 months after, and just by doing 1 month of light therapy or whatever that would. So,
I had that laser and LED light eye, and now
yeah, and think about how much less pain medications, better sleep, all that. Now, this was a study that came out, I think, in 2006, and they took NSAIDs, non-steroidal anti-inflammatory drugs, and they took light therapy, went head-to-head, and you know what? There was no difference. The only difference was NSAIDs can cause major side effects. Light therapy doesn't and has benefits. So, like we're right now, there's so many NSAIDs being prescribed, And you have hyperbaric and light that are two powerful treatments that we know for that. Tissue regeneration in inflammation, proliferation, and remodeling or maturation, scarring. Light therapy helps in all three phases. So this is pemphigus vulgaris, third-degree burns, post-surgery, diabetic wounds, bone. You put light over bone, and you'll see bone regeneration, mineralization, and that's a key thing. This is without taking calcium, no supplements. Okay, teeth and gums, stem cells, brand new cells, liver regeneration. So this is in vitro. This is in vivo in the human body. They looked at putting it over areas that were low in glucosamine. You guys have heard of that. And without taking glucosamine, they put light, and the body made. It's just glucosamine, So the body made more glucosamine hydroxyproline, and there's a reduction in healing time and tissue regeneration. Okay, that's a brain injury with light therapy treated. Increased circulation. Okay, that's another slide right there. That's healthy blood vessel plaque buildup, and all of a sudden, when you add nitric oxide, it opens it up so you have more blood flow. So imagine this is a normal circulation, this is your highway, this is an exit, and then all of a sudden there's an accident, a car accident or whatever, and then the body starts shunting the blood this way and then starting to create new blood vessels, and then this becomes the alternate pathway. And that's a natural process that your body does. It's energy dependent. It's a catch-22 because it starts because there's low oxygen, and that sends a signal to do that. So that's why, for the aging a process, oxygen therapy can be quite beneficial because you're just giving the body all that energy to start this, to help in this process. Coronary arteries. Okay. So light therapy can be targeted to any area. Now, we're going to end in this slide, I think. Yeah. No, two more slides. Okay. We're almost there, guys. Your keys fell. So this is a picture you can't see if you turn the lights off. Can you turn the lights off? There. You see, that's inside the hyperbaric chamber. That's inside the chamber where light therapy is added in. Can you turn the lights on? Okay.